Hello, I'm James Mallory. I'm the chairman of the Iredell County Board of Commissioners. And on behalf of the Iredell County Board of Commissioners, I'd like to give you an update on COVID-19 in Iredell County and the surrounding area. Last time that we had an update was about 3 weeks ago, June 11th. And when I was closing up or sharing the numbers that we had at that time, I indicated that we were now doing mass testing and had gotten 2 weeks worth of test results back, which had some troubling numbers in them. The first round of tests had a positivity rate of less than 1%, which is good. The second round of tests had positivity rates that ran between 10 and 13%, which is bad. So didn't know at that time whether that was an anomaly or a fluke. Since then, we have had the opportunity to continue to do these mass testings, at least 2 more iterations, and have a little bit more clarity that I want to share with you. In terms of actual numbers, the number of positive cases in Iredell County today, as of 4 o'clock on July the 11th, is 790 cases. Now, to give you a little perspective, a month before, on May the 30th, we stood at 251 cases. So we have more than tripled the number of cases in the last month. What accounts for that? Well, I think there's really 3 factors. Now, the first factor is we're doing more testing. We've done over a couple thousand tests, and as a result, you're going to pick up more positive cases when you do more testing. And that's the whole point, is to try to figure out what is the actual infection rate in the county. So it's not so much the numbers that matter as the positivity rate, the percentage of folks that are testing positive out of the population that's tested. And as I mentioned, we were looking at a concerning number of 10 to 13%. And the new testing, when you all average it out, and these are folks that have gone in to get tested that are basically asymptomatic. These are not folks that have been referred by doctors. They've taken an opportunity to be able to come in sight unseen and just for their own peace of mind know whether or not they test positive. Well, the number is settling out to be in the 9% range. So for just simplicity's sake, we'll say 10% of the population of Iredell County is a carrier and is presently infected and infectious. That is, that they can pass on the COVID-19 virus to other people. Now, that's a larger number than I thought we'd be looking at. When you think about it, that's 1 out of 10 people. That's a significant number. And as you know, throughout the nation, particularly in the South and the West, we are experiencing across the board increases in numbers, some states much more than others. To date, when you break out Iredell County, we have in the northern sector 204 cases, in the central sector 321, and in the southern sector 265. When you look at population ratios, about 21% of our population lives in the northern sector, north of Interstate 40. The number of cases they have in that sector accounts for about 26% of our total. So the chances, therefore, if you're of picking up this infection is greater based on the population, 26% versus 21%. In the central area, which accounts for about 34% of our population, that accounts for 40% of our cases. And in the southern 4 zip codes of the county, which started out, when we first started reporting the number of cases in the county, started out with a preponderance, almost 62% of our cases, is now about 34% of the cases, and it accounts for 45% of our population. So when you compare Iredell County with surrounding counties and other counties in the Charlotte metro area, we are doing, based on a comparison in terms of total numbers as well as per capita, we're doing better than most. Of the 9 contiguous counties with Iredell County, only 2 have better rates than we do, Lincoln and Alexander. Catawba, Wilkes, Yadkin, Davie, Rowan, Cabarrus, and Mecklenburg all have significantly higher per capita rates of infection, sometimes driven by clusters, whether it's in Wilkes County, driven by the Tyson Foods outbreak, or whether it's in Rowan or Cabarrus, given some high numbers of folks infected in congregate care facilities like nursing homes. Once again, we've been very fortunate not to have significant outbreaks in our nursing homes and other congregate care facilities, to include the Iredell County Jail. They've been very limited to 1 or 2 individuals and 1 or 2 staff, and been right on top of things. So those are, particularly the nursing homes, are the most vulnerable populations we have. And that's where you run up a large death total. And we've had 9 deaths so far to COVID-19, which is pretty low in comparison to other counties that are surrounding us. And if you add in there Union County and Gaston County as metro Charlotte counties, they too have a higher per capita and actual number of infections. So out of all of those 9 contiguous and 2 metro counties, a total of 11 counties total, there are 2 smaller counties that have lower per capita rates than we do. So that's good news. But the real yardsticks are what's your hospitalization rate and what's your positivity rate. The hospitalization rate has tripled in Iredell County in the last month. We've gone from having, on average, 6 or so folks in the hospital to now having 20 or 21 in the hospital. And these are folks I checked to find out, is this a possibility of individuals that have come in to get elective surgery, that prior to that elective surgery have been tested. It turns out that they were asymptomatic but test positive, and so it just looks like we have more people hospitalized for other reasons that are being captured by the COVID statistics. Well, what I found out from Iredell Health Systems is no, these are all COVID-19 cases that come in presenting distress, primarily breathing problems that are associated directly with the COVID virus. So our hospitals are still in a position where they are able to handle the demand. They have ventilators, they have testing capabilities, so they are able to handle these numbers. But the numbers today are not going to be the numbers a month from now. If you look at where the trend line is going, we could easily quadruple the number of cases that we have, and quadruple the number, or better, the number of cases in the hospital, which could, in fact, result in a shortage of beds or ventilators. You know, I have a son-in-law who is a third-year resident in a hospital in South Texas. The county that he's in is experiencing significant growth of cases. You know, we've had an additional 500 plus cases in the last month in the county in which he lives in and the hospitals in which he is working in. They had 400 cases, not in the last month, not in the last week, but in the just one day, 400 additional cases, 2 days running. And that's what happens when this virus kicks into an exponential phase and it overwhelms the ability of our healthcare providers to care for us. In South Texas, they've asked the National Guard to come in to set up field hospitals because they have run out of ventilators and running out of ICU beds. A month from now, we could be in the same situation very easily. Or we could stop the bleeding and hold our position. Frankly, given the fact that we're dealing with lagging indicators here, folks are going to present that they are infected or need hospitalization. That may be a week from now or 2 weeks from now. So it's already in the pipeline. So we're going to continue to see increases in the numbers of hospitalizations, actual tests, and hopefully not deaths. But those numbers are going to drive us to at least double by the end of the month the number of positive cases we have. And if we end up doubling, I would submit that that's a victory, because half the story's already written, and from now until the end of the month, we can write a different story and have a different result. Besides the fact that we're doing more testing, another reason we have more cases is because we opened up the economy. We started phase 2 of the governor's plan around Memorial Day, and more economic activity, more businesses to go into, just means there's more opportunities for people to become infected or infect others. And if you're not masked, then you've just created those opportunities exponentially. The other reason that we're probably seeing an increase is the fact that besides opening the economy and doing more tests, we have this, we're actually now seeing the actual numbers of people that are infected out there as a percentage, and it's a higher percentage than we anticipated. So what can we do? Well, it's really simple. We don't have a vaccine, and we can't count on herd immunity. People get infected, they're asymptomatic or they have mild symptoms, and when they get tested for antibodies, in many cases they find they don't have any because evidently their immune systems were just strong enough or the viral load was low enough that it just didn't need to produce an awful lot of antibodies to deal with the situation. So just because someone's had this or think they've had it doesn't mean you can't get it again. So what can we do? No vaccine. We have viral treatments now. Remdesivir is knocking about 5 days off an average hospital stay, but that's a treatment, a therapeutic. It's not a preventive. Other than a vaccine, the only preventive that we have is how you personally conduct yourself. And it has to do with the 3 W's, which is watch your social distancing and be 6 feet away. Number 2 is to wash your hands or clean surfaces that you may use or come in contact frequently with other people with. And most importantly, to wear a mask. Look, this is a medical issue. This is not an issue of politics. This is not an issue of faith. This is an issue involving a virus that's just doing what viruses do. And this particular virus is shared primarily by people transmitting it through the air. So anything we can do to limit that transmission is the most effective thing possible to do. And that's simply wearing a mask. Wearing a mask, if it's not an N95, does not confer a significant amount of protection to the individual wearing the mask. It simply limits and protects limits the transmission to other people. So by everyone wearing a mask when it's appropriate, and you can't maintain social distancing, you're out or you're inside in a room for an extended period of time with people, depends on a lot of factors. But the bottom line is, when in doubt, wear the mask. If you're out walking in the woods, nobody around you, you don't need to be wearing a mask. But if you're in contact with people, you need to be. Pure and simple. The one reason, in addition, that we've had an uptick is we have had some clusters of places where there's been significant spread. And you read about, okay, down in Miami, down in Myrtle Beach, that people are in bars and they've shared it all over the place, and high infection rates because people are sitting on a bar stool. Well, we don't have any bars that are open in North Carolina. If there's a bar associated with a restaurant, they may be open under certain conditions. Breweries or places that distill spirits and sell on it, they're open, but they're all maintaining social distancing. The fact is, we don't have a bar on every corner, like a lot of places do. We have a church on every corner. And right now, the preponderance of the clusters of intensive spread are related to some church services. So, if you're a member of a church, if you're a pastor of a church or a deacon of a church, you need to take care of your flock, not just spiritually, not just emotionally, but physically. We need to be wearing masks, no ifs, ands, or buts. If you're singing, and this has been shown by empirical data, that social distancing of 6 feet to be safe is more like 27 feet. And that's because you're projecting large aerosolized or droplet-laden viral loads that are being projected all over a sanctuary. So, if we're going to get a handle on this, we have to start in our businesses, in our churches, where we go for a place to hang out and recreate, and as well our government. And I'll share with you that on the 17th of March, I signed a state of emergency for Iredell County. And I recently signed an addendum or an addition to that state of emergency where we are requiring all Iredell County employees, there's some almost 1,500, to be wearing masks in their work environment. That's to protect themselves from each other and to protect their ability to accomplish their mission. When you go in to get a service from any of our departments, there have to be people there to provide that service. And if we have in a small department even, 1 or 2 people that test positive, and how many out there are likely to be positive even now? 1 out of 10. Then if that's been transmitted and other people are positive, they're all going to go into quarantine. And if they're all in quarantine, they can't be providing the services that you're looking for. So in order for us to accomplish our mission, to provide you what you need in whatever capacity that is, understand that's why we are wearing masks, and that's why we are requiring customers coming in to use our services to likewise be masked. Now, there's some exceptions. There's some folks that have viable, realistic, physical, medical reasons why they can't at all impede their airways or their ability to breathe. Understand that. We will continue to provide the service, but that service will be provided in a reasonable way that does not put our employees or other customers at risk. So to share a little more on what we're doing in the county, and I believe our municipalities have also taken some actions in varying degrees to limit their ability or to enhance their ability to provide services in a safe way. And our businesses are required by the governor's order to likewise do the same. This is how we're going to get through this. If everyone in this county wears a mask when they come into contact with other people, then we will get this growth back under control, and we'll be able to continue to expand economically. And the bottom line is the bottom line there. We have to have our businesses in business to employ people. And if we lose control, like they have in some places in the country, then it will impact our businesses' ability to employ folks. And the unemployment compensation bump up expires July 31st. We don't need to have people looking at losing their homes or losing their vehicles because they're not able to make payments because their employer is not able to keep them at work because their workforce is out due to COVID. It's all a clear chain. So without further ado, I would turn this podium over to our county manager, Beth Jones, and she will share with you a little bit about what we're doing in terms of our county policy to deliver services. Thank you.